A HAGL lesion, or humeral avulsion of the glenohumeral ligament, is a tear of the inferior glenohumeral ligament from the humerus. The IGHL is one of the major ligaments that stabilize the shoulder joint. A HAGL lesion can cause shoulder instability, which is when the humerus dislocates or subluxates. On an MRI, a HAGL lesion can appear as a small, round, or oval-shaped defect in the humeral attachment of the IGHL. The defect may be filled with fluid or scar tissue. Other findings that may be seen on MRI with a HAGL lesion include a tear of the posterior band of the IGHL, a tear of the labrum. The prevalence of HAGL lesions on MRIs performed for shoulder pain is estimated to be around 1.5%. However, it is important to note that HAGL lesions can be difficult to diagnose on MRI, and false positive diagnoses are common. In some cases, a HAGL lesion may only be confirmed with arthroscopic surgery. If diagnosed with a HAGL lesion, treatment may include arthroscopic surgery to repair the IGHL. Non-operative treatment options for HAGL lesions are often successful. However, persistent pain or instability, surgery may be necessary.